I love is IEHP has over 8,000 medical providers in their network.
Yes, and Arrowhead Regional Medical Center is just one of them. Our community here in the Inland Empire is truly special. The community is one that needs and thrives on the support that our doctors can give. Especially at our hospital at Arrowhead, we have programs in place, and with the partnership that we have with IEHP, I think we are able to provide a lot of resources for our families.
IEHP is encouraging families to prioritize their health by scheduling well-child visits.
They're not just once a year. Well-child visits are so much more than that. Especially early in age, we have children come in sometimes every couple months. Think of a well-child visit as not just a sick visit, but more like a regular tune-up. We monitor growth, we monitor developmental milestones, we monitor how they're doing in school, we monitor how they're progressing in terms of their physical health, and even their emotional health as well. But also at the same time, we help with preventative care, such as vaccines, resources for families that need a little bit more help.
I'm an Inland Empire native. I've lived here my whole life. When our earliest daughter was born, our first daughter was born, we didn't really have a lot of family left in the area. It was the well-child calls, I think, that made the biggest difference. The reminder to go to different doctor's appointments, it made us feel like we were doing, the right thing for our kids. Some of the biggest points in your life is going to be that 0 to 5 kind of range. That's when you're most susceptible. It's when you're growing the fastest. So the well-child visit makes sure that you're hitting all those milestones, you're meeting with your doctors, so they can do all those check-ins, you get the shots that you need, so you stay nice and healthy.
The reminders that we would get were very helpful as a first-time mom who's trying to balance a work schedule and his school schedule at the same time with no family in the area to help us out. Little things fall through the cracks, so having those reminders helped keep our family on track, and I really appreciated that.
By the time Riley was born, I was employed here. I've been with IEHP about 8 years now. I am a software architect. One of the very first projects I worked on was a newborn outreach campaign, and it was so unusual. I'd only been here maybe a month or two, and I was already reaching out to families that were in my exact situation, helping them get their information to the county, getting them on the roll so we can get into the well-child visits and send them on their way to getting everything done the right way.
I really encourage our families to stay on top of their wellness visits. One of the reasons that we really recommend and emphasize well-child visits is because of the benefits that it gives you downstream. A healthy child turns into a healthy adult.
I am so thankful for IEHP for the well-child visits because it made me feel like I was being a good parent. It made me feel that I was doing the right thing for my child.